And Dr. George Salib is here today with Orange County Eye Institute. Nice to see you again.
Thank you. Nice to be here.
And you're talking about a rather serious subject today, and that's macular degeneration. We often hear about that. And exactly what is it, and how does it come about?
Great question. Macular degeneration is what it sounds like. It's a degeneration of the part of the eye called the macula. The macula is the very back part of the eye, the inner lining of the eye. And it's part of the part called the retina. You can actually see a picture of the retina on the front of the on the screen over here. On the left, you'll see what a normal retina looks like with the circular optic nerve there with the blood vessels coming out of it, and then the macula, which is the darker part right between the vessels, is nice and clear. Whereas on the right side, you'll see something that says drusen. Drusen are basically fatty deposits that accumulate in the retina, and that's the beginnings of macular degeneration. That's dry macular degeneration, which tends to be a little bit better than the wet kind of macular degeneration, which you'll see on the next slide. You'll see a normal macula, and then you'll see some bleeding on the right side. And that bleeding and that blood and fluid accumulation is what we call wet macular degeneration, which tends to be much more severe.
Okay, is this the way you're talking about fatty deposits and you're talking about the bleeding here, it almost sounds like people who may have, I'm not saying it is, but high cholesterol, those symptoms, you get fat deposits in the blood, or you may get an area that starts to bleed. What causes this, and how can we tell if we have it? Is it a similar situation?
Well, it is similar in that a lot of the times people will have, the way they notice it, first of all, is they'll start to notice things are not quite right in their central vision, because macular degeneration affects the central vision. So for instance, they'll be looking at their blinds in their house and the lines will appear kind of crooked. They might look at words. They're trying to read and the words just don't come out quite right. They have to restart their sentences several times. They might notice that faces are kind of hard to see. And then they might also have a sudden loss of vision in one eye. You could see here that normal vision, you could see the kids nicely, whereas if you're looking at someone's face, there's a smudge right in the center of their vision.
Okay.
And it does indeed, like you said, have something to do with how we live in our lifestyle. Cholesterol, these are very similar to cholesterol deposits. It's more common in people with a high-fat, high-cholesterol diet. There's certain factors such as age that we can't really control in terms of your propensity towards having macular degeneration. As we age, the percentage of people who have macular degeneration increases, so that by the time you're in your 80s, about 10% of us will have severe macular degeneration, and about 1 in 4 of us will have intermediate macular degeneration. So yeah.
So it is common here. You have a graph here, and obviously, like you said, age definitely plays a factor in it, but not everyone, just because they're in their 80s, is going to get this.
That's right. Yeah, family history has something to do with it. Genetics is often very important. Whether you smoke or not, smoking actually increases your chance of macular degeneration by 2-fold. Race, Caucasians tend to have it more often, and just obesity, high fat, high cholesterol diets, they all tend to contribute to that, as well as sunlight. If you wear sunglasses, it can help to decrease your chances of having macular degeneration.
Now, do people have certain kinds of diseases? Diabetes comes to mind. Would they have more of a likelihood of getting this?
You're absolutely right. Well, hypertension or high blood pressure is one factor that can increase your chance of having that. Obesity, hypercholesterolemia or high cholesterol, definitely. All of those things that tend to affect your blood vessels can affect you and cause macular degeneration, because the wet kind is basically a growth, an abnormal growth of blood vessels, because you have a lack of oxygenation in the back of your eyes. So that can cause the wet macular degeneration.
Okay, and what kind of treatments are available here?
Well, the first thing I usually tell people is you need a regular eye exam. That is the best thing, because a lot of the times people will have, you'll start to notice, the doctor will notice that you have macular degeneration before you even notice it. You'll start to notice these little drusen in the back, and then they can advise you. I tell them they should use that Amsler grid, which is that graph paper looking
Okay,
thing.
and I believe you have a slide that shows that.
Yeah, and that's right there, and you see a dot in the center, and in the center of that, you're supposed to cover one eye and look at that dot in the center and look at those lines and make sure they're normal, which is all straight, all the lines are present. Whereas in macular degeneration, you'll start to notice wavy lines or a smudge or parts of the lines missing. So I have them do that every day with each eye. And then you have to look into healthy living, which is you look at, for instance, no smoking. You don't want to smoke. That increases your chances of macular degeneration. Sunlight you want to avoid by wearing sunglasses. You can have vitamins that you can take. There's a formula called the AREDS formula, which is related to the age-related eye disease study, which showed that taking certain vitamins, which are A, C, E, zinc, and copper, can be helpful in people with intermediate macular degeneration. Now, there's a higher risk of lung cancer in people who take vitamin A or beta carotene. So there's a newer formula, which I tend to prefer, called the AREDS 2 formula, which takes out the vitamin A and replaces that with lutein, zeaxanthin, and also adds omega-3s. So those are all tend to be helpful. That one hasn't been proven yet, but they're doing studies to see if it will help. And eating green leafy vegetables like such as spinach and kale, which are rich in antioxidants, is also very helpful.
Now, if a patient comes in and you find out that they might have the beginning stages of this,
Right.
is there a timeline where you can tell them this is how much deterioration you can expect over the next few years? Is it different for all different people? If they change their lifestyle, can they go on, let's say they're 70 years old.
Right.
Are they going to lose their eyesight in a few years? Or could it be if they live to 90 or so, they might have a little bit of loss of eyesight, but
It's a great question. It really depends on how the eye looks when you first see it.
Okay.
So if you see just a very small drusen in the back of the eye, they might never really even develop macular degeneration. They can have just very small drusen. Now, once those drusen start to become larger and what we call more confluent, that means they get grouped together, then that's a more ominous sign. If I start to see some pigment in the back, some like coloration in the back of the eye, or even a little bit of blood, that's also a more ominous sign. So it really depends. If you see those small drusen, you could say, well, you might never be affected. Whereas if you see the pigment, the larger drusen, and some blood, then you might say, well, you probably have a few years of vision left in your central vision. But the one thing that's important about macular degeneration is it doesn't cause complete blindness.
okay.
So it just causes you to lose your central vision, which can be devastating, for instance, if you like to read. But definitely it does not cause complete blindness. And it's totally individualized on the person.
Okay. Sounds like some great information. And you wanted to comment that you're available to come to clubs and have presentations and talk, right?
That's true. I'm always available to come to your organization, to your club, and just give a talk about eye disease if you have any eye questions. A lot of people, when I tell them I'm an eye doctor, they ask me lots of eye questions. So I figure that there's a lot of people that want to know more, and I'd be happy to do that.
Yeah, I think that would be very good. And numbers on the screen there, you can see. And I think it'd be wonderful for you to come to these clubs because, as you said, there's so many different individualized questions that people have from if they have macular degeneration, if they have dry eyes, or something, cataracts, where they want to get sort of one-on-one information. This would be a great way to do that. So if you want to give Dr. Salib a call, do so, and you have a club here that you would like to have him come and speak, that would be great. I think you'd be very good at that. You're great at this, so
I'd be delighted
I think you'd be a great speaker.
Thank you.
All right, thank you very much, and the slides were great. We appreciate you bringing those along, and we'll see you in a few weeks.
All right, thank you.
All right, take care. Folks, we'll be right back with Director Juan Chang.